Hi, everybody. My name is Jenny Faith. I am the epidemiologist for Central Oregon, and I'm going to walk you through our new data dashboard that's up on our website. So this is up on the Deschutes County COVID-19 page, so you can look for it here. This really gives an overview of our data for COVID. It replaces a lot of the tables we used to have, and we've been working with our IT department to develop this over the past few weeks. So I'm just going to give you a quick introduction to all the information in here, and you can look for that on our website. The dashboard, I'm going to start here in this corner in the upper left. This gives a nice summary of kind of the situation here in Deschutes County. So this box with the total cases, this gives you an idea of, as of today, the total number of cases we've identified for the county. And underneath there, you can see the increase from yesterday. So you can always look for the last updated. So this is updated on the 23rd, and you can see we increased 2 for our total cases from the day before. Our total number of deaths are always down here in this box, so you can be aware of how many COVID-19 deaths we have for our county. And we also put the total recovered, so you can get a general idea of how many active cases we have, and that number is displayed up here too. These also tell you the percentage of total cases who have died and the total percentage who have recovered. So that's a really great place to look for general information about our COVID situation in Deschutes County. And then we have some nice breakdowns over here that give you an idea of cases by sex, cases by travel history, and cases who have been hospitalized for COVID. So I'll just show you for cases by sex. This is really nice. At the bottom, there's a breakdown for percentage. So you can see we have a slightly higher percentage for female cases versus male cases. And then if you hover over that section in the chart, you can see the number there. So as of the 23rd, we had 351 males, 436 females, and 0% undetermined. Same goes for travel history. So this is the percentage of our cases who reported to our team that they had recent travel outside of their home area within their exposure period. So that's usually around 14 days before their symptom onset or before their positive test. So this gives you an idea over time what percentage of our cases report that they've traveled. Hospitalization, again, you can hover and see the numbers. This gives you an idea of the percentage of all of our cases who were hospitalized during their illness. So as of the 23rd, about 8% or 60 cases have been hospitalized for illness. So again, a really great snapshot of just some general information about our cases. I'm going to scroll down here and show you these graphs at the bottom. So this chart here shows the percentage of cases versus population per age group. So I'll break that down for you. You can see on the left here are different age groups. So these are 0 to 9-year-olds all the way up to age 80 and older. And this dark bar, so you can see the dot down here, the darker color is kind of the breakdown for our COVID cases. So you can see around 4% of our COVID cases were in that 0 to 9 age group. The highest percentage is here in the 20 to 29-year-olds, around 20% of our cases were in that age group, and so on. And then the lighter bar is for our county population. So really the two combined gives you a great idea of which age groups are being disproportionately affected by COVID compared to the population in general. So a great example of that are these 20 to 29-year-olds, where 20% of our COVID cases were age 20 to 29, but only 11% of our county's population is age 20 to 29. So that kind of gives you an idea that age group is being affected by COVID disproportionately more. That's a great place to look if you want to get a sense of age group breakdowns for our cases over time. I'm going to click through these other tabs at the bottom. So, and you can just click here. This is a really similar to the cases by age group, but it shows the deaths by age group compared to the population. So for us, you can see 83% of our deaths, of the 12 deaths in Deschutes County from COVID-19 were age 80 and older, compared to 4% of our population. So this is a great place to look if you're wanting more information on deaths. And the final tab here is total cases per age group. So this is where you can actually get case counts per age group and see how that's changed over time. This goes back to early April. So it's pretty interesting. You can see over time when certain age groups really started to see an uptick. Like again, the 20 to 29-year-olds I mentioned, you can see there was a really big increase here in July. And then again, if you hover, so this is for the 22nd, you can see the total case count for that age group. So if you ever want to know how many cases were in a particular age group, you can just hover and see. And this is a great place to look for changes over time. If we're starting to see more or fewer cases in different age groups, you can really look at the slope of these lines and how they're changing over time. So that's cumulative cases by age group. And then the last one over here are our school metrics. So we have two different graphs here. One is for our weekly case rates, and that's the number of cases per 100,000 population in Deschutes County. So I'll walk you through that one first. We do have little reference lines here. So there's a K through third metric, which is 30 cases per 100,000. And then we have an all students metric, which is 10 per 100,000. And you can see week to week where we fall for our case rates per 100,000. You can pretty easily see if we've met or are not meeting that benchmark that's set by Oregon Health Authority. So for example, in the most recent week, we had a case rate of 24 cases per 100,000, which does meet that K through 3 metric, but does not meet the all students metric. So that's the case rates. And then weekly percent positivity is also here. So you can look over time. Again, we have the benchmark shown, so you can see how we're doing compared to that. And you can see our percent positivity every week. And again, you can hover and get the date and that value there. So that's kind of the overview of the dashboard. This is updated Monday through Friday, usually in the afternoon after Oregon Health Authority releases their numbers for the day. So you can look for that. You can always look here at the last updated section to see if it's been updated for the day. I will say the school metrics, those are only updated once per week on Mondays. So you can look for an update there every Monday, again, typically in the afternoon. Thanks.